Question 1. Which rhythm is defined by 3 or more PVCs occurring consecutively at a rate over 100 BPM? A. Bigeminy. B. Ventricular tachycardia. C. Atrial flutter. D. Torsade de pointes. Answer: B. Ventricular tachycardia. Question 2. A nurse sees a prolonged QT interval on ECG. Which medication should be used with caution? A. Amiodarone. B. Digoxin. C. Metoprolol. D. Atropine. Answer: A. Amiodarone. Question 3. What is the appropriate treatment for a conscious patient in stable monomorphic VT? A. Synchronized cardioversion. B. Vagal maneuvers. C. For amiodarone. D. Chest compressions. Answer: C. For amiodarone. Question 4. What is the distinguishing ECG feature of junctional rhythm? A. Wide QRS complex. B. Absent or inverted P waves. C. Sawtooth atrial waves. D. Peak T waves. Answer: B. Absent or inverted P waves. Question 5. A nurse observes an irregular rhythm with fibrillatory waves. What is the most likely diagnosis? A. Atrial flutter. B. Ventricular tachycardia. C. Atrial fibrillation. D. First-degree AV block. Answer: C. Atrial fibrillation. Question 6. A patient has a temporary pacemaker. What should the nurse monitor for on telemetry? A. Widening QRS complexes. B. Failure to capture. C. Inverted P waves. D. QT prolongation. Answer: B. Failure to capture. Question 7. Which electrolyte imbalance increases the risk of digoxin toxicity and ventricular arrhythmias? A. Hypernatremia. B. Hypokalemia. C. Hypoglycemia. D. Hypercalcemia. Answer: B. Hypokalemia. Question 8. A patient has ST segment depression. What does this typically indicate? A. Normal variant. B. Pericardial effusion. C. Myocardial ischemia. D. Hyperkalemia. Answer: C. Myocardial ischemia. Question 9. Which finding indicates a first-degree AV block? A. Variable PR interval. B. Dropped QRS complexes. C. PR interval greater than 0.20 seconds. D. Absent P waves. Answer: C. PR interval greater than 0.20 seconds. Question 10. What is the nursing priority for a patient with pulseless VT? A. Administer lidocaine. B. Begin CPR and defibrillate. C. Notify the provider. D. Perform synchronized cardioversion. Answer: B. Begin CPR and defibrillate. Question 11. Which rhythm is best described as chaotic, disorganized electrical activity with no identifiable waves? A. Atrial flutter. B. Torsades de pointes. C. Ventricular fibrillation. D. SVT. Answer: C. Ventricular fibrillation. Question 12. A nurse notices ST elevation in leads 2, 3, and AVF. What area of the heart is affected? A. Lateral wall. B. Septal wall. C. Inferior wall. D. Anterior wall. Answer: C. Inferior wall. Question 13. What is the defining feature of atrial flutter? A. Irregular RR intervals. B. Wide QRS complex. C. Sawtooth P waves. D. Absent P waves. Answer: C. Sawtooth P waves. Question 14. Which medication is used to treat symptomatic bradycardia? A. Adenosine. B. Epinephrine. C. Atropine. D. Amiodarone. Answer: C. Atropine. Question 15. What should the nurse do if pacemaker spikes appear without a corresponding QRS complex? A. Increase for fluids. B. Reposition patient and notify provider. C. Administer atropine. D. Apply oxygen. Answer: B. Reposition patient and notify provider. Question 16. A rhythm strip shows a progressive lengthening PR interval followed by a dropped beat. What is this rhythm? A. First degree AV block. B. Mobitz type 2. C. Mobitz type 1. D. Third degree AV block. Answer: C. Mobitz type 1. Question 17. What is the best nursing response when a patient in atrial fibrillation suddenly becomes hypotensive and unresponsive? A. Prepare for synchronized cardioversion. B. Administer atropine. C. Call provider for orders. D. Monitor rhythm hourly. Answer: A. Prepare for synchronized cardioversion. Question 18. What is the expected rhythm after successful defibrillation of ventricular fibrillation? A. Normal sinus rhythm. B. Asystole. C. P. D. Sinus bradycardia. Answer: D. Sinus bradycardia. Question 19. Which action is appropriate when a monitor shows fine ventricular fibrillation? A. Synchronized cardioversion. B. Defibrillation. C. Vagal maneuvers. D. Chest X-ray. Answer: B. Defibrillation. Question 20. What is the nurse's priority when a patient shows symptomatic bradycardia and hypotension? A. Prepare for synchronized cardioversion. B. Call the rapid response team. C. Administer atropine. D. Place patient in Trendelenburg. Answer: C. Administer atropine. Question 21. Which rhythm is identified by variable P wave morphology and irregular rhythm with at least 3 different P wave shapes? A. Atrial fibrillation. B. Sinus tachycardia. C. Multifocal atrial tachycardia. D. Junctional rhythm. Answer: C. Multifocal atrial tachycardia. Question 22. A nurse notices a second-degree AV block type 2. What is the priority concern? A. Progression to atrial fibrillation. B. Risk of converting to complete heart block. C. Frequent PACs. D. Junctional tachycardia. Answer: B. Risk of converting to complete heart block. Question 23. A patient in V-Fib is defibrillated. What is the next immediate step? A. Check for pulse. B. Apply oxygen. C. Resume CPR. D. Administer atropine. Answer: C. Resume CPR. Question 24. A nurse sees a regular rhythm at 150 BPM with no visible P waves. What is the most likely rhythm? A. SVT. B. Atrial fibrillation. C. Sinus tachycardia. D. Junctional rhythm. Answer: A. SVT. Question 25. What best describes the QRS complex in ventricular fibrillation? A. Narrow and sharp. B. Absent and chaotic. C. Tall and peaked. D. Inverted and wide. Answer: B. Absent and chaotic. Question 26. What should a nurse suspect if pacemaker spikes occur during QRS complexes? A. Failure to capture. B. Oversensing. C. Failure to sense. D. Normal pacing. Answer: C. Failure to sense. Question 27. Which patient is the highest priority? A. Patient in sinus bradycardia, HR 55 BPM, asymptomatic. B. Patient with junctional rhythm, alert and oriented. C. Patient in V-Tach with a pulse, hypotensive. D. Patient in atrial flutter with HR 100 BPM. Answer: C. Patient in V-Tach with a pulse, hypotensive. Question 28. What is the primary treatment for symptomatic second-degree type 2 AV block? A. Atropine. B. Cardioversion. C. Pacemaker. D. Adenosine. Answer: C. Pacemaker. Question 29. Which feature differentiates Mobitz? I. From Mobitz 2. A. Drop beats after fixed PR. B. Progressive PR prolongation. C. Variable QRS width. D. Narrow complex tachycardia. Answer: B. Progressive PR prolongation. Question 30. Which medication is indicated for narrow complex tachycardia unresponsive to vagal maneuvers? A. Epinephrine. B. Amiodarone. C. Adenosine. D. Digoxin. Answer: C. Adenosine. Question 31. What rhythm is characterized by P waves present, regular rhythm, and a rate of 45 BPM? A. Junctional escape rhythm. B. Sinus bradycardia. C. Atrial fibrillation. D. Third degree AV block. Answer: B. Sinus bradycardia. Question 32. A patient has atrial fibrillation with a rapid ventricular rate. What is the initial goal of therapy? A. Restore sinus rhythm. B. Slow the ventricular response. C. Defibrillate immediately. D. Increase preload. Answer: B. Slow the ventricular response. Question 33. What is the main purpose of synchronized cardioversion? A. Deliver shock at random time. B. Defibrillate the heart completely. C. Shock on our wave to reset rhythm. D. Prevent bradycardia. Answer: C. Shock on our wave to reset rhythm. Question 34. What is the best response to a monitor showing asystole? A. Immediate defibrillation. B. Start CPR and give epinephrine. C. Apply pacing pads. D. Administer adenosine. Answer: B. Start CPR and give epinephrine. Question 35. A rhythm strip shows wide QRS, absent P waves, HR 36 BPM. What is the most likely rhythm? A. Junctional escape. B. Ventricular escape. C. Sinus arrest. D. Mobitz type 1. Answer: B. Ventricular escape. Question 36. A nurse notes ventricular bigeminy. What is the pattern? A. Every second beat is a PAC. B. Every second beat is a PVC. C. 2 PVCs followed by pause. D. Alternating junctional and sinus beats. Answer: B. Every second beat is a PVC. Question 37. What finding would be expected in a patient with chronic atrial fibrillation? A. Irregular pulse. B. Bradycardia with regular rhythm. C. Tall P waves. D. Prolonged PR interval. Answer: A. Irregular pulse. Question 38. A nurse is caring for a patient with third-degree AV block. What should be kept at the bedside? A. Defibrillator pads. B. Adenosine. C. External pacemaker pads. D. Narcan. Answer: C. External pacemaker pads. Question 39. A telemetry strip shows grouped QRS complexes separated by pauses. What is the most likely rhythm? A. Atrial flutter. B. Mobitz I. C. Junctional bradycardia. D. SVT with aberrancy. Answer: B. Mobitz I. Question 40. A patient is in SVT with hypotension and chest pain. What is the nurse's priority? A. Vagal maneuvers. B. Synchronized cardioversion. C. Administer digoxin. D. Administer lidocaine. Answer: B. Synchronized cardioversion. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.